Hello, everybody. I believe that you can now hear me. Welcome, everybody, to the town hall for the University of Guelph. And let me first of all say, for those of you who haven't met me or don't know, I'm Charlotte Yates. I'm the President and Vice Chancellor of the University of Guelph. And I'm really delighted that so many of you were able to join us today for this important town hall with the entire University of Guelph executive team. Before we begin, I'd like to note that this event will be recorded and will be posted on our website for those who could not be here today. So if you have colleagues, please let them know that they can still listen in if they weren't able to join us live. As we gather virtually and begin our discussion today, I would ask that we first reflect on the lands on which we reside and those that connect us as part of the University of Guelph. As we know, the University of Guelph campus resides on the treaty lands of the Mississaugas of the Credit and lands of the Anishinaabe, Haudenosaunee, Lenapehoek, and the Wendat peoples, who have inhabited these lands for centuries. We recognize that these lands continue to be home to diverse communities of First Nations, Inuit, and Métis peoples. Through this land acknowledgement and our actions today and every day hereafter, we reaffirm University of Guelph's commitment to ensuring that Indigenous ways of knowing, being, and doing are meaningfully and respectfully woven into the framework of our institution, with the goals of reconciliation, decolonization, and an equitable future for all. The purpose of today's town hall is to bring together students, faculty, and staff from our Guelph and Ridgetown campuses to provide an overview of the latest return to campus plans for the fall, and most importantly, to answer your questions. I realize that there is a terrible irony to having this discussion today, as we know that Premier Ford is about to announce another lockdown. But in many ways, today is the best day to begin this conversation. I just actually came off a conversation talking about how COVID for many people has been and continues to be a very dark tunnel. And we need to have hope about what the future is, but we also need to be confident that that future is safe for ourselves, our families, our friends, and our communities. This is the beginning of a conversation about how our community can gradually, and not tomorrow, not the next week, but gradually begin its planning to return to campus under kind of robust health and safety conditions. We recognize that public health experts are saying we're in the middle of the third wave. So I want to emphasize that the plans that we're discussing today are getting us ready for the fall. We have 5 months until September. A lot happened to us between November and March of 2019-20, when most of us, up until that last moment, really didn't know what a pandemic was. Now we've been in it for more than a year. And so we also expect significant change over the next 5 months. We expect that there will be the opportunity for a gradual, well-planned return to campus over the late spring and summer, mindful of health and safety, but also the incredible need for planning and thoughtfulness as we think about returning to campus. Today, I will say, will be the first of a number of town halls. So please don't feel this is your only chance to hear, have conversations about and ask questions about return to campus. We will hold regular town halls in order to keep the community up to date and in order that you can keep us apprised of your interests, concerns, and also optimism about the future. As we plan for fall 2021, our approach is driven both by our mission and by a set of principles. We are primarily a learner-centered research university whose raison d'etre is our students, our faculty, our teaching, our research, and all of the people who contribute to our excellence in those domains. Above all, though, when we think about our principles of returning to campus, above all, the collective health, safety, and well-being of our community continues to guide our decision-making. Any return to campus approach will be gradual and inclusive. It will be respectful. We will remain responsive to the dynamic nature of the pandemic and public health guidelines, and as flexible as possible to the vulnerable needs of our community members. Over the past year, we were able to safely reopen parts of our campus. For some teaching, we have had residents, essential research, and other important services and operations. And I want to say in particular a great thank you to all the people who've been working on campus, have worked safely, but continue to contribute to our mission for research excellence and teaching excellence, but also for keeping us safe. All of those hospitality and physical resource staff, library staff, CCS staff, who work so hard to have kept the campus, the physical campus, running the past year. I also want to say thank you to all of you who have worked so hard in a virtual environment to also keep us up and running. It's been a partnership between all of us to make sure that we've been successful to date. We're also hearing and seeing positive news that our robust rollout, most Canadians will have access to a vaccination by the summer. As many of you know, we are home to a vaccination clinic on the University of Guelph campus. It is in the UC and it's up and running, and it's been aided by more than 500 volunteers, many of whom are students, faculty, and staff. We are also working very, very closely with the Wellington-Dufferin Guelph Public Health Unit and the Guelph Family Health Team. We are now vaccinating 500 people a day, but are very quickly ramping up to 750 per day. When vaccine supply is available, we have the capacity and expect to ramp up to 2,000 a day. The clinic is among the many ways that faculty, staff, and students have remained committed to our mission to support one another and improve life over the last year. I want to personally thank all of those who are working with the vaccination clinic. Thank you for your dedication to not just the University of Guelph, but to the entire community who sees the University of Guelph as giving hope to all of them. I know there's strong community interest, a lot of anxiety about the return to campus. So let me assure you that as we plan, and this today is about planning for the fall, are evidence-based and shaped by community input. We continue to hear that several in-person elements of university life are irreplaceable for rich teaching, learning, research, work experience, and the mental health of our community. The results of our student surveys show a clear desire for on-campus learning, and we are currently reviewing the results from the faculty and staff survey. I want to thank all of you who participated in that survey. That information will be critical, both in understanding your concerns, but also helping us plan for the future. We know that there's a lot on your mind as we contemplate the return to campus, and your feedback today will help us. Our hope is that we will be able to experience the familiar bustle of a new school year at U of G this fall. But in order to do that, requires planning, planning, planning. So we're 5 months away from the fall, and we're beginning conversations with staff, faculty, and administration about signage, cleaning, PPE, ventilation. We know that we have to be thoughtful and planned in our return, and we also know that that planning needs to happen now. I know for some of you are saying, why would we start now when we're in the middle of a lockdown? There are a couple of good reasons for that. One is, it was very easy for us to kind of flee to our homes in March. Most of us had homes to go to, and therefore, and yes, we had makeshift offices and places to work, and I've seen many of them on the Zoom calls I participated in with many of you. But nonetheless, that exodus from campus was relatively easy. Bringing back thousands of people to work, study, research is a lot more complex operation. It must be done with care, and that requires time. We need to use the time we have now so that we're not scrambling as we move forward. Secondly, I want to emphasize that despite today's cloudy and cool weather, soon it will be warm and soon summer will come. I am asking and expecting all of you to take some summer vacation. We worked so hard last summer, many of us unable to take the vacation because of the need to plan for the fall of 2020. I do know we have the time now to plan so that you can take time off. I believe time off is needed for everyone across campus. It's been a stressful, difficult year, and that time off is important for us to share positive time with family, if possible, but also for us ourselves to recuperate. We're committed to keeping you informed of our plans as they evolve and also to continuing to listen and get feedback. So I am confident that we can do this together with hard work, thoughtfulness, and kind of empathy for our colleagues. So what's the format of today's event? And Times Live is always a little bit of an odd one because there's always a little bit of a lag and we can't have the same dynamism that we can do on a Teams where you can pose me questions directly. So the vice presidents and I look forward to answering your questions this afternoon. And the format will be each vice president will do a little introductory presentation on their area of campus. And then you'll see that you can post your questions in the chat. And I will ask perhaps Kim or Audrey to advise us in the chat how people might, so I can read it out, how people who are on the phone might be able to pose a question. Our goal is to answer as many questions as possible. If we're unable to answer all your questions, we will have an FAQ available, which will pick up on those questions. Sometimes we'll bundle questions together that we see as similar. And of course, for the latest updates and answers, you can visit universityofguelph.ca at COVID-19. So let me now turn the mic over to our provost, Gwen Chapman, who will begin with presentation around academic planning.
Thank you, President Yates. And thank you to everybody for taking time to join us today as we look ahead and as we plan for fall about the steps that we need to take to prepare for that. As Dr. Yates has acknowledged, I also want to acknowledge that we are in a very challenging time right now. Things feel tough now, as they have for the past year. Even in a normal year, this would be a time of the year when faculty, instructors, and students are feeling pretty exhausted. And given the pandemic, I know that all of those feelings are significantly exacerbated. As we watch those COVID numbers and as we are anticipating another lockdown, certainly this is a context for concern. And all of that makes it difficult to look ahead to the fall, to imagine a context where the pandemic will be waning. But as President Yates has said, we do need to do some planning now so that we are ready for fall when we anticipate that things will be very different. Throughout the last year, but certainly over the last couple of months, we have continued to be in regular contact with Wellington, Duffer, and Guelph Public Health. And it's based on their advice and the recent developments of the vaccination rollout that we are, optimistic for a safe return to in-person teaching and learning activities this fall. If we can go to the next slide, please. Just, highlighting a couple of key points here. Certainly, we welcome and are excited about the possibility of being back on campus. As Dr. Yates said, we have certainly heard from students and faculty alike that many people are very much missing that face-to-face contact and are looking forward to being back in the fall. But again, you can be assured that the health and wellness of our campus community is our top priority. We do expect that some of the health and safety measures will still be in place come September, and our return to campus will continue to be guided by public health and government protocols. We will continue to monitor things over the coming weeks and months and adjust our plans as needed. So before I do discuss what the academic delivery will look like in the fall, I want to reiterate that our plans that we're presenting today are based on the vaccination rollout and the current predictions for the fall, not our current state. And so we will continue to look towards that, how things will change as the public health situation changes. So to move to the next slide, which focuses on course delivery. You know, throughout the pandemic, of course, we have seen a significant shift to remote and online learning, but as mentioned, we are planning to resume primarily face-to-face teaching in the fall. And that means that most courses will return to face-to-face, whether that is a full face-to-face delivery or some kind of hybrid model of delivery. The hybrid models of delivery can include some combination of in-person activities and continued use of remote learning tools that we have all become very familiar with over the last year. Things like live capture, recorded lectures, and so on. Implementing the hybrid models does require appropriate technology, so we are making enhancements to many of our classrooms over the summer to ensure that any plans that the instructors have are adequately supported. We have circulated a detailed breakdown of the classroom updates over the last week, but generally I would say that these enhancements certainly will assist capture, broadcast of lectures, as well as to facilitate engagement with remote learners. Beyond the technological support, there will be additional training and human resource supports available to instructors. And throughout the summer, some training sessions can be scheduled. Classrooms will be available to practice using the technology for those who are interested in doing that. So the final piece of the puzzle, of course, is what courses will be offered when the information about that will be available. So currently we plan for course information to be posted on WebAdvisor by June and available to students for course selection in early July. And again, these dates are based on our current predictions for the fall, and we will adjust as we need to if required. So moving on to the next slide to touch upon some of the campus and student services and our plans for those for fall. Similar to our plans for course delivery, we expect to safely increase our in-person student and academic services. That includes opening all of our campus residences for single room occupancy. Student Housing Services is working closely with Wellington Dufferin Guelph Public Health to keep all aspects of health and safety in mind as we make our plans to return. The primary focus will be on ensuring space for first year and international students. As well, we will be continuing to support international students who must observe the mandatory quarantine program. And we are hoping we will certainly encourage students who are going to be in residence to, as well as all students, to be vaccinated if possible. With a return to residence, we will also be seeing a return to a hybrid O-week. We know that the University of Guelph is renowned for its student experience, so I'm pleased to share that this year the student experience team, faculty, and staff partners will be delivering some in-person activities during O-week. It will also include an O-Week 2.0 that's dedicated to our current first year students who missed out on an in-person experience last fall. I know I talked to a few students during the recent house calls, and one of them was talking about her excitement about being on campus in the fall, but worried that she would get lost, worried that she wouldn't be able to find where her classes are. So we are going to be providing those supports. The university programming will be complemented by student associations who will be hosting their orientations in a virtual format. We are similarly planning for a robust delivery of in-person and virtual services to support all students. A summer transition program for, again, our first year students who are looking forward to being on campus for the first time. As well, throughout the fall, student experience as well as clubs and associations will plan for some in-person programming. In terms of other campus and student services, there will be a full range of health and wellness services available both in person and virtually. The library does expect to move back to more normal hours with increased access to safe study spaces over the fall. And in athletics, we expect a full complement of sports, intramurals, clubs, and fitness programs will resume. So again, while we're excited to be able to offer more in-person services, I do want to stress that all of those offerings will be planned in strict accordance with the public health guidelines to ensure the health and safety of our community. So that's sort of my overview, and I look forward to being able to answer some questions in the question period.
Thank you very much, Gwen. So let me now turn the mic over to Malcolm Campbell, our Vice President Research. Over to you, Malcolm.
Thank you, President Yates, and thank you everyone for joining us today. It's wonderful to have the opportunity to talk to you, even if it is under such extenuating circumstances. Within the research enterprise at University of Guelph, because we are a research-intensive university, we've employed a research-based approach over the course of the last year to help us ensure that we're able to have significant activities within the research enterprise. Our research-based approach has involved effectively setting hypotheses, testing those hypotheses by collecting data through consultation, through examination of best practice, through the exploration of the literature, and then devising solutions that have allowed us to navigate the research that we do at University of Guelph through these challenging times. Next slide, please. Over the course of these activities, we've learned some important lessons. First of all, research during the pandemic could be managed safely, including within university facilities, and even for research involving human participants. In fact, some of our research activities at University of Guelph have carried on unabated since the state of emergency was declared 54 weeks ago. We've had our research staff in our testing laboratories and across our field stations, 450 people all told, who have continued to work despite the pandemic and have been able to do so in a safe manner. On the basis of this experience, we were able to bring almost 2,000 researchers online by the time the end of the summer rolled around, so in August of 2020. Again, maintaining research activities within campus facilities without an instance of transmission occurring or even any case of COVID-19 occurring within the research enterprise. That said, it's been clear, and there's a good literature growing on this, that the pandemic has had uneven effects. Some groups are much more negatively impacted by others. In particular, equity-deserving groups have been negatively impacted by the pandemic. And similarly, some research areas and activities, those, for example, involving face-to-face research, those where research cannot be done at a distance, are much more negatively impacted than others. The flip side of that, of course, is that there have been some new opportunities that have emerged. New venues for doing research, new research opportunities, new funding to support that research, and remote access to partners and to talent that previously hadn't existed or was difficult to do. We now don't give second thought to, for example, engaging in teams and connecting in fora like this, whereas it might have been difficult for us to do 56 weeks ago. So some new opportunities as well as challenges that we have to contend with. So with this knowledge in hand, how is it that we grapple with the research enterprise as we learn, as we work to regrow it and reinvigorate it going forward in the future? Next slide, please. As we move from merely recovery, and arguably, and we have good metrics to show this, our research enterprise has recovered to an extent despite the pandemic conditions, it's important for us to move to a state of reinvigorating and reimagining what the research enterprise at University of Guelph looks like. We can do this by building on what it is that we've already accomplished through the use of strategic management plans, research management plans that we put in place that are based on public health requirements that allow people to do their research within university facilities is something that we can build on. It's been tried and tested, and as I said, it's enabled us to bring around 2,000 researchers back to University of Guelph operated facilities, indeed across 600 different locations. What's going to be very important as we take advantage of what we've accomplished is that we have equity, diversity, and inclusion at the fore. As I said, it's largely been equity deserving groups, priority groups, that have been detrimentally impacted by the pandemic. And therefore, we need to be particularly attentive as we regrow our activities and reinvigorate them, that we pay heed to the ongoing challenges that those same groups are going to face as we move forward, making sure that everyone has the opportunity to achieve the same successes, and that no research areas or types of research are disadvantaged, and that in the end, opportunity prevails. We'll have to manage new health and safety realities. We are really not entering a post-COVID world. SARS-CoV-2 will still be with us. We will need to take on board what it is that's being done in other jurisdictions and based on the best literature, and make the wisest decisions, as we have for the last 54 weeks, to move the research enterprise forward. We'll need to reimagine our robust research platform. What are things that we didn't do before that we might be able to do now? How might we be able to do things better than we did before? Let's reinvigorate the platform that we put in place. And our teams have started to look at how we can do this. Finally, related to that, are there opportunities to leverage new and emerging opportunities, new research areas, new ways of doing research, and new funding? Are there things that we can do in terms of accessing partners through networking and accessing the talent pool through same sorts of mechanisms? Final slide. How will we go about doing this? Well, again, as I said, making use of our tried and tested approach. We've been making use of, by adapting our successful pandemic planning approach, as I said, using research management plans, guided by our strategic research plan, and we really have taken advantage of it through the pandemic. This has involved making use of that strategic plan, the principles embedded therein, and consulting with our research community to understand how best to serve their needs. We will be continuing to do that. Leadership will be provided by our 22-member research continuity group, who has acted throughout the pandemic in an absolutely phenomenal way to help us actually have a more active research enterprise than comparator institutions, certainly here within the province and arguably nationally. We'll be able to adapt best practices from other jurisdictions to achieve our desired goal of research invigoration, and benchmark against other institutions to make sure that we are performing at least as well as they are. Finally, all of these activities will be supported by the Office of Research to ensure that we are fulfilling our obligations both provincially and nationally with regards to policy, action, oversight, compliance, and communication. We look forward to working closely together with you to serve you as we have over the course of the last 54 weeks to really make a difference and ensure that University of Guelph continues to mobilize knowledge into action and realize our ambition to improve life. Thanks everyone for your time. I look forward to answering your questions.
Thanks, Malcolm. And now let me turn it over to our new, well, relatively new Vice President of Finance and Operations, who some of you may not yet have met, Sharmila Rashid. Sharmila.
Thank you, President Yates, and many thanks to all of you for taking the time to join us. For those of you who don't know me or I haven't met us yet, I am on campus every day if you want to stop by and say hi, making sure we're physically distancing and wearing our masks. I'm Sharmila Rashid, that's VP for Finance and Operations for the University of Guelph, and thanks again for joining us today. While we continue to plan for a variety of scenarios and will always put the health and safety of our students, faculty, and staff first, all indicators and advice from public health point to COVID-19 looking very different in September compared with now. I know this is really hard to imagine given what is happening today. However, the Government of Ontario's COVID-19 vaccination plan projects all at-risk individuals will be vaccinated, and many members of the general public will receive their vaccination by September or at least their first shot. And as President Yates said, we do have a robust clinic running here in the UC building to support these efforts. The current science is also showing that the COVID-19 vaccination seems effective on most variants, and there may be a review of the physical distancing requirements, which could decrease to 1 meter coming up into September. As you know, this is an evolving time through the pandemic. Testing and contact tracing in Ontario is established, and rapid testing is being deployed widely. The university has been participating in rapid testing pilots since the end of February. As a result, we are planning with this optimistic view for September. Next slide, please. Each manager, leader, or designate will develop a plan to gradually return their employees to campus beginning May. Return to campus is to be prioritized for those providing services that are critical or time sensitive in supporting teaching, research, on-site student experiences, and return to campus activities. A staffing framework, prioritization decision matrix, and process map for developing and implementing an operational plan will be shared and posted on our Return to Campus webpage. Our very robust and hard-working Return to Campus committee are working to pull all of the templates, documents related to Return to Campus on this webpage, and more information will come on this. Managers and leaders should consider a hybrid work arrangement and associated equipment needs that for their areas. The plan should integrate individuals' consideration for accommodation that is consistent with the university human rights commitment. Occupational health and wellness, your human resources representatives are there to assist you on these various accommodation options. Some employees will continue to work remotely, determined by their managers and in partnership with them. Human Resources is working on a flexible work policy for post-COVID university that would align with our academic and research mission. Everyone must continue to complete those COVID-19 screening and reporting requirements. Our team, again, our Return to Campus committee are working really hard behind the scenes to ensure that that tool is fairly easy to use and can be used on your cell phone. Next slide, please. All employees must complete the environmental health and safety COVID-19 infection prevention control awareness training through CourseLink. Physical Resources will be working with the leaders within the department to ensure that all cleaning and disinfectant protocols and supplies are in place and how to order those. Department units will need to develop a method for maintaining record of employees attending campus to facilitate contact tracing as required. The plan should be shared with the Joint Health and Safety Committee for review and feedback. While managers, leaders, or designate will be creating the operational plans in partnership with their employees, deans and the AVPs must approve all plans. Health and safety will confirm all health and safety measures have been implemented within the areas. Managers, leaders, or designates should provide orientation to all returning employees on the plan that they have developed, emphasizing responsibility and accountability by every single employee. The manager or the designate will need to monitor the compliance to the plan. All of us will need to adjust our plans as required by the university, public health, and government policies as the pandemic evolves. Next slide, please. Implementing the operational plans requires increased connectivity and communication across the campuses. While extensive planning has been happening behind the scenes, there is a need to ensure that each department unit has identified a leader to ensure measures are implemented and maintained. The executive leadership team is appointed a Return to Campuses project manager. I'm really pleased that Melissa has accepted this to support the leaders with their plans and implementation. Thank you for taking the time, and I look forward for questions through this venue or by email.
Thank you, everyone, for your presentation. We'll now move into question format, and I'll be moderating the question. I've been following the chat, and while I'm waiting for some of the, there's nothing in the published version. So let me just do a little bit of traffic directing here around some of the questions. I'm going to start with a question which I've seen has been asked by multiple people in slightly different forms. So, and this is for you, Gwen, around the fact that we're talking about a full face-to-face term. How are we managing that relative to if some students need or would like to do more virtual learning? What kind of facilities are classrooms going to have to be able to do some of that hybrid teaching so students who can't come onto campus can still access lectures? And So perhaps starting around that, as that's a theme running through a number of questions.
So just so I'm clear, so just questions about what supports we're putting in place for that sort of hybrid kind of teaching that we're hoping for?
So what are you expecting in terms of, clearly we don't have public health rules yet that are saying how much of social distancing is recommended at 1 meter rather than 2. Clearly that changes what it looks like on campus. So I guess and then what about students? Will they have a choice around courses? So I think that whole distance, in-person, hybrid, and how you're balancing that.
Yeah, and so I would say that we are still somewhat in our planning stage on this. At this time, we are asking our units to engage in discussions about what courses they're planning to offer and what kinds of delivery modes are expected. We would normally have a certain proportion of our courses being available through distance education, and that will continue. So there will be some distance education courses available, and other courses, it will be a range. There may be large lecture courses where the lectures are available or are being delivered remotely, and then there will be labs or tutorials that are face-to-face. In other cases, it will be blended learning where, again, maybe there would be 1 lecture hour per week and the other material is being delivered remotely. We know that different things work for different people, both in terms of what works for instructors as well as what works for students. So we anticipate that there will be a range of delivery methods. As I mentioned, we are upgrading classroom technology. We did some last summer and we're doing more this summer, so that all of our larger classrooms will be equipped with cameras and microphones, so that for instructors who do want to live stream, they will be able to do so. For instructors who are wanting to lecture capture and then post the recorded lectures, that will be an opportunity as well. And as you said, we are continuing to to look at what we think is the most likely scenario in terms of things like physical distancing, and depending on that will really affect what our classroom capacity is and to what extent we're able to have students in the classroom and really how many students in a given classroom. And as we get a bit more clarity on that in the coming weeks, that will help us to have, be able to provide more information. I mean, at this point, I would say that, students generally should expect to be on campus in the fall, but there will be some remote learning opportunities available as well.
So Gwen, maybe I'll do a follow-up question as this comes up, and one of the questions in that is, can you just, the question is, are you working with the unions and around the collective agreements to sort out some of these?
Yeah, absolutely. And I think that's one of the reasons why we don't have all of the answers now, because particularly we're certainly working with the appropriate unions, definitely working with the Faculty Association right now. We're sort of in the middle of negotiations and discussions about a letter of understanding that will help us clarify what our shared understandings are on some of those issues.
Thank you. Sharmila, there's a question here, and I'm going to broaden it beyond PPE. Will appropriate PPE, but I could say adjustment of workstations. Many of us have seen the plexiglass where you have potential interaction. Will there be appropriate PPE and other arrangements and adjustments to workstations made for staff who are working on campus in the fall?
Thank you, President Yates. Appropriate PPE will be given to staff. Depends on the requirements identified by the managers for staff that are front-facing to customers. That means students or other staff. So it depends on their jobs. Also, if identified by the managers that they're front-facing and they need plexiglasses, that's part of the planning process that we will have the physical resources put in place. However, if you're working behind the scene in your offices, etc., and you're not interacting on a continuous basis with students and other faculties and employees, you may not need plexiglasses or PPE, but you will need to wear face coverings at all times as part of the public health protocols.
And I apologize. Thank you very much. I apologize. I ended up jumping too early into questions as, of course, Daniel Latin, a very important part of this is around communication and our external partners. So I apologize, Daniel. Our Vice President External will move into his presentation. So please accept my apologies.
That's certainly fine. No apologies necessary. I think if we've learned anything during the pandemic, it's actually the need for us to be able to improvise and to be able to be impromptu according to the new cues. And I think that's certainly what we're seeing very much from the government as well, and that's been a continued theme. And we're seeing that despite the fact that September 2021 seems like it's very close to us, 5 months is a long way away for any government, especially a government during a pandemic. We're seeing that governments are finding actually from week to week actually a great deal of time as there's so much unknown. So what we are still seeing is of course, and everyone's aware of that today, that there's many variables at play right now. So long-term planning does become difficult. But at the same time, what we do know is that there is progress, as we've heard from our colleagues around the table, that there is progress expected, and we have to plan for actually a September that does look very different than it is today. And the decisions that are being made on a day-to-day, week-to-week basis continue. And it was with all of us, we were a little bit surprised about the shutdown that's being announced today. However, it should be no surprise because the province has indicated that it will take decisions to be able to protect the province going forward as well. So it's very important that when we talk about all three levels of government is the province that actually is the biggest determinant of where we are going, and they are the ones that actually introduce the rules and make the decisions. Oftentimes those can be prompted by local public health, but it is the province that is dictating everything. And that's what they have been doing the past year, and it will continue as well. And those decisions are going to depend upon case counts, and including community spread, positivity rates, and presence of the variants, new variants of COVID that are coming in. And so we have to actually pay a lot of attention to that, and our ability to collectively, manage these aspects will really actually help us inform, as you've heard, our plans going forward into the fall. We know vaccine rollout, is very ambitious. We've heard, today that everyone who wants one should be able to have a vaccine by the end of the summer. But of course, this is dependent on supply, which changes from day to day. And there's also, of course, some confusion, such as the AstraZeneca guidelines and other vaccine conversations that actually, do pose some concerns about the strategy as well. But we believe that we are working, that we will be in a significant, the different period in September with vaccine being readily available. And it's important to recognize as well that despite today's announcement, the Ontario government is really facing intense pressures to continue to open the economy and to reopen it as well. It's with great reluctance that they are making this announcement today that we'll see about these shutdown provisions. Ontario has had some of the most significant restrictions and regulations in place in North America, and we will see the province to continue this for the next month, but hopefully that will be the last of actually the shutdowns, because we're seeing as well, not only that there's fatigue, but there's also, I think, a fear from the province about some political backlash, because the June 22 election for provincially that is mandated is only a little bit more than a year away, and they want to really focus on more positive non-COVID related issues. So, we are planning, and we're setting these plans that are based in the appropriate information we have, but they will be determined, of course, as we've mentioned, by vaccine supply, by the uptake of a vaccine, and also, of course, by possible outbreaks in the Guelph community as well. So our ongoing actions, though, are to maintain our close interaction with all three levels of government, to be able to make certain that we are able to articulate our own plans to the province in particular, to make certain that they're recognized and that we are working collectively with our public health experts, both on campus and at Guelph, Wellington, Dufferin Public Health, and that we are having a very robust plan that protects actually the safety of the community and allows us to move forward in lockstep, I think, with our own campus community, but also with others in the sector. We are approaching this as well with a sector advocacy approach on many different issues. We are advocating for vaccine availability for all students, faculty, and staff as soon as possible. We are advocating for access to provincial supply of rapid tests. And we continue to advocate for both provincial and federal governments for support on facilitating in-person classes for international students, as well as requirements for quarantine and visa processing, and of course vaccination for those international students. So it's a very dynamic environment with all three levels of government. We're working very closely. We're monitoring. We're adjusting our plans, and we're feeding that in to our community, and we're also having that inform our communications. And as you know, we've had a very robust communications approach throughout the past year, and we're going to continue this as well. And I apologize for people who are in some ways perhaps exhausted by the number of communications that we have gotten out there. We are trying to over-communicate rather than under-communicate. We're trying to actually make certain that people have the information they need, because we know that right now there's a lot of misinformation as well. So we want to try and make certain that people have the appropriate information they need to make their decision as well. So you're going to see a communication come out later on today that's going to be actually about the shutdown. And after we're able to analyze the announcement that is happening at 1:30, we'll be able to make those changes and able to communicate the measures that will be on campus going forward. Those will likely be very similar to what was announced in January, because I think that those are the premises that we're working under those regulations. We will continue to be working very closely with our public health and government colleagues on messaging, both social media, but also ongoing messages about not just university developments, but also about vaccines, about vaccine hesitancy, about the changing colors and what they mean to our community. And we will also be looking for sooner as we head into more eligibility for the next vaccination stages. We'll be looking for targeted student vaccination campaigns as well to be able to start later this spring. And again, we're going to be leveraging information from our Wellington, Dufferin, Guelph public health colleagues as well as the city of Guelph as well. So what you are also going to see is we are cleaning up our one-stop webpage for Return for Campus frameworks and templates, because we know that there's been a lot of communications over the past year and there's a lot of information to sift through. You'll see actually a new shutdown page that will be introduced as well to be able to have that relevant information going forward. So we commit to be able to provide information to you as soon as we can. Recognizing that there's some complexity sometimes to the messages that go out that require broad consultation because of the impact it has for our entire community in all the different areas on campus, but also making certain that we're aligned with Wellington, Dufferin, Guelph public health. So with that, thank you very much for the opportunity.
So Daniel, maybe I'll ask a question, you to answer a question that really follows up on one that's been posed, and that is the availability or the expected availability of vaccines for international students. So I wonder if you could, because someone has asked, well, international students won't have it available to them. Can you maybe make a comment about that?
So this is a very live, discussion right now that is happening with our Universities Canada advocacy group, as well as with individual universities and the federal government, to be able to make certain that both our province and our federal government recognize that we need to make that availability for international students, so that they have access to it, so that after their quarantine is complete in Canada, that they can actually go forward. We are working through those issues, and they are very top of the advocacy agenda.
And finally, Daniel, can you make a comment? Someone asked, what about students who are unable to come to the international students come into Canada? Could you comment on the advocacy we're doing around visa processing? Because visa processing has been perhaps the most significant reason why international students have not been able to get into the country.
Absolutely. That again is one of those key advocacy elements that we have going forward. We're pushing very hard for the visa processing, which is ground to a halt, for all of our international students over the past year. We are asking for them to step up, add additional resources to make certain that is increased. And we know we have very strong support from our Minister of Colleges and Universities, Ross Romano, who sees international students as very crucial to our economy. So the province has been a very good ally in pushing for this. However, we're going to need to continue that advocacy going forward. There is the balance, of course, that people are afraid of new entrants, new variants coming into Canada, and there's a lot of fear. But we need to be prepared for more students this fall. We also need to have some sort of framework as well that actually can recognize those who have been vaccinated in their home country as well. So we have to be able to fit that into the plans going forward with the government.
Thanks very much, Daniel. So one of the questions, there's been a question that has been posed in different forms by a number of people, has to do with the issue of requiring a vaccine and balancing that with the privacy of the individual, or perhaps the rights of those who may not want a vaccine. And I am going to take the first answer. Just this morning, I was on a call where so far I would say it's unlikely that it will be legal unless the government decides to introduce some kind of vaccine passport, that in fact it would be, I'm not sure it would be legal for us to require it. And therefore, I think this speaks to, Daniel Atlan did speak very, very much about the importance of communication to overcome vaccine hesitancy, to make sure that also, and then there's the logistical support to make sure people are able to get their vaccine. So we're really doubling down on the communication of the importance of vaccination. And then around the coordination, you should all know that faculty and staff who work and students who work at the University of Guelph can register for their vaccine, whether they live in Guelph or not. So it's very, very important. And as Guelph is rolling out the vaccine as rapidly as possible, we're doing well as a community. I think that's important, especially as we start to think about kind of as we plan, both for campus, but also our lives in terms of our family lives and so on. So I'm going to pose a couple of other questions around remote work policy has come up on a number of questions. So I'm wondering, Sharmila, if you did mention about the eventual development of a flexible work policy. I see we have Chris Nutt with us. So I wonder, Sharmila, I'll turn it over to you to answer.
I'm sure. So, and continuing to work in remote from home, that will be a decision made by the managers in consultation with the employees. So they are going to be employees that are going to continue to work remotely in the next few months, going into the fall, etc., based on the needs of that department and the work type that employee or employees are doing. Going forward in the future, our Human Resources Department is working on a flexible work policy that post-COVID university and what that looks like that will align with our university academic mission and research mission.
Thanks very much, Sharmila. I think I would like to, I'm going to turn to Gwen just to double down a little bit on the answers around classroom and the technological refit of classrooms, if you could, please.
Absolutely. So we are certainly refitting many of our centrally booked classrooms. And so we have the classrooms that normally seat more than 60 students. We're upgrading 24 of those over the summer. So they will all have cameras, microphones and screens so that the instructors can interact with students who are online if desired. And then several or 12 smaller classrooms will have all of that, plus microphones in throughout the classroom so that students can actually interact with each other. I believe some of the colleges are also upgrading some of their college book spaces. And I would say that, instructors who are wanting to make use of that technology, so that's certainly with the larger classrooms, that's the majority of our larger classrooms. And instructors who want to be using that kind of technology, just make sure that the scheduling services knows that, and I'm quite confident we'll be able to put instructors who want to use the technology in rooms that have it.
Thanks very much. So I'm picking up on a couple of different questions around timing of what we are doing. And so let me start by just reminding people, one of the reasons we're meeting today is because it's about planning. This planning takes time. It's not like we're suddenly rushing back onto campus, as many of you will know. Obviously, Sharmila's on campus. I'm often on campus, partly because I think it's important that the essential staff also see me on there. But nonetheless, it's not like we're all rushing back. I think the issue is planning, and planning with health and safety as our major priority. And so as we do that planning, as you can see, there's some complexity to that planning, but also we need to be thoughtful. And your questions, of which we now have, I think, 150, tell us that there are a lot of questions. So as we do that planning, that's important. I think around timing as well, we're guided by public health, and we're guided by public health, what their expectations are. And their expectations are that as the vaccination rollout accelerates, as more vaccines become available, that there will begin to be some shifts in terms of how our government, how the federal government respond. And finally, I think we need always to remember, and there was a separate question about this, and I'm not sure if we have a full answer on this, and that is we need to balance both physical and mental health safety. As many as I see here saying they're uneasy, they want to make sure we're physically safe, and I understand that, and we're working exactly on that thing. The other issue is the mental health and mental health of people, and I think the isolation of working at home, often in suboptimal arrangements, the lack of interaction with our peers, with our colleagues, has had its own toll. So we always need to balance that. But balancing doesn't mean we take health and safety, physical health and safety at risk. It really means that we consider both and that we are evidence scientific based, not based on, and that I think will carry us a long way in terms of the appropriate timing that we begin to come back on campus and also how we do that work. So let me pose, I will ask if there is a question, and I think it's an important one. And I'm not sure if Sharmila, Gwen, around the mental health supports, additional mental health supports. And the question did say, please don't say our mental health kind of initiative, something more. Are we planning something special around mental health supports for people coming back to campus? And that could be students, faculty, or staff. So Sharmila or Gwen.
I will ask either Gwen or Marta to comment on the mental health support. Marta, I don't know if you want to take a stab at that first, or Gwen.
I can maybe take a first stab at it and certainly say on the student side that we will certainly be continuing to provide very robust mental health supports for our students through student wellness. We will be providing both virtual as well as as in-person supports, we would plan for that in the fall. And so, you know, I think that this is an area, as President Yates said, that is certainly an area of concern. And we have continued to really ramp up our efforts over the last number of years. We fully recognize that, that this is an area of concern for both faculty, staff, and students, all of those. And so are continuing to look at what there is that we can put in place through our employee assistance programs, through the kinds of accommodations that we can put in place as needed. And then, as I say, for students with the student accessibility services and student wellness, that we are certainly continuing to provide the services and looking at how we may need to ramp those up as well. Martha, you may have more on the staff side.
Thanks, Gwen. I appreciate the opportunity. We recognize that throughout this pandemic, the needs of faculty and staff have evolved and changed in terms of the kind of resources that they access or they would like to access. So we are in continual conversations to get that feedback to see what can be developed or what other resources can be provided to faculty and staff as we move in terms of looking to plan to come back in a greater presence come September. It's important to us, and it has been, and it always will be, in terms of the mental health supports that we provide faculty and staff, particularly in this very unpredictable environment that we find ourselves in. I see through the questions, as you will see, that there is a degree of anxiety for individuals in terms of what will September look like. And we want to ensure that resources are available, that are accessible to faculty and staff in terms of supporting their own mental health as we look to have a greater presence on campus.
Thanks very much, Martha. So I'm going to take, there are a couple of questions. One of them is around rapid testing, and I want to broaden that if I can, that in addition to the vaccination clinic and our encouragement of people to get the vaccine, in addition to the masking and the physical distancing, so far the university has been engaged. We're one of only 2 universities engaged in a provincial pilot around rapid testing of our staff and students on campus at present. We are hoping and expecting the federal government has available a large supply of rapid tests. And so we are looking at what does that next stage of rapid testing look like, because I do think that surveillance that it allows us to do, but also, but what we want is a rapid test that is easily deployed. I think some of the ones that are the nasal swabs are really uncomfortable, and students particularly have expressed a dislike of them, so fair enough. What we're looking for is a rapid one. And finally, we continue to do the wastewater testing. We're not the only university doing it, but we're very fortunate to have some really excellent researchers who are guiding us in this, and that also. So multiple areas in addition to PPE, masking, social distancing that we're doing to continue to both monitor campus, but also to keep it safe. I do want to, one of the questions asked is around how do we measure success? And I think that's a really great question because it actually captures all of the VPs, because how do we measure success? What will it look like if we say we've been successful? So I'm going to start us off, and then I'm going to go to each VP and ask, what would you measure as success? And I think some of the things that obviously we continue to be take pride in our research intensivity. So we'll want to hear from Malcolm about what would it look like to have research success. I think students being able to, in a timely way, complete their degree, to be their degree of choice. There's a question from a student about, and I'm asking VPs to kind of pick up on one or two of these issues. What about the experiential learning opportunities that students have missed out on and which are so valuable to them, both in terms of their experience in their education, but preparation for the next step? Can we comment on what we're doing there? And of course, around what would success look like in terms of government advocacy, communication, as well as planning on campus. So I wonder if I might just quickly go to all 4 VPs, and I'll start with Malcolm.
Thank you, Charlotte. I think you already mentioned, and thank you for doing so, identifying the fact that we have had successes over the last year with the research enterprise. I know that despite the pandemic, our applications, for example, for tri-agency funding are actually up this year, and our overall tri-agency funding amounts are up 27% over last year. So we've really been able to continue to move forward with the research enterprise over this time period, despite the hardships that have been there. But that's not to say that people haven't experienced hardships. And I think what success looks like for me in the future, and I think for us as an institution in the future, is inclusive success, ensuring that we're leaving no people behind, that everybody is having an equal opportunity to achieve and realize their full potential at University of Guelph in as much as their research ambitions are concerned. So I think that's what success looks like, and we're striving to realize that. As I said, we've got some good metrics to show that we're making progress in that regard, and a bit of a teaser trailer for those of you who are senators on today's call. I'll be reporting on that at Monday's Senate meeting on just what some of those successes are, and you'll see some of those roll out in university announcements. So we've enjoyed successes. We could do better. Inclusive reinvigoration is what I'm calling it. That's what success looks like.
Over to Daniel.
Thank you. Well, great question. And I think we've had some great successes actually during the pandemic. I think actually in our ability to, I think, demonstrate actually our responsiveness to the community, our connection actually with governments as well. And I think we've been recognized for the wastewater treatment research, for example. That was a great thing that we had very high degree of I think noticed by all 3 levels of government, and it was actually mentioned by the Premier as well. So I think our success in being a partner with our community, our local community, such as in the Vaccination Center, I think that's certainly a great measure of success. I think our success as well with the province in terms of being a partner with them for getting the economy back on track and being a great fabric, piece of the fabric of Ontario. That's going to be very important as well. And I think also nationally, I think we have an opportunity to raise our profile nationally in terms of our presence and our profile too. And I think that success will also be, as we turn our minds more for advocacy for post pandemic, I guess benefaction from all 3 levels of government too. We know that we still are under some challenges because we were hit quite significantly, our operations, by not just the tuition rollback and freeze that the province had put in when they assumed power, but also by the operations, the effect on our operations and our grants actually going forward too because of COVID. So success will look like actually getting some funding, hopefully from the province and from other sources. And I think it's important to recognize that, despite the fact there was a large announcement in the recent budget that universities got significant dollars, did not go to the University of Guelph because those dollars went to institutions that were actually under much more significant financial pressures than we were in worse shape. So the majority of universities were not eligible for those funds. Those were given to ones that actually were facing difficulty. So that will certainly be very important as well. And I guess the doubling down on the international advocacy too, to make certain that we can actually have success there, to be able to help our internationalization as well as our EDI strategies, because that will be a very big part of that.
Thanks very much, Daniel. Sharmila, what does success look like for you?
Thanks, President Yates. So this is going to come from the heart. I'm hoping to see all of us employees or staff and faculty can wrap a ring around together, supporting each other through all of these anxiety, stress, mental health, so that we can hug each other from afar, to get a campus together to support their students as they return to campus. I think that we need to reach out to each other, have ideas, suggestions, send me all of it for the plan so we could put it together so we can welcome our students back in September. As Malcolm said, that we don't leave anyone behind. So I'm hoping that that's what success will look like, that we can come together and support each other for that welcome in return.
Thanks very much. Finally, to you, Gwen.
Well, my colleagues have certainly already identified a number of the things that I would say. I mean, in terms of people's the feeling of being supported, the feeling of coming together. I would say, you know, on the student side, that we always pride ourselves in the exceptional student experience and the positive feedback we get from our students about their student experience. And so, you know, in that way, I think that success will be a continuation of our reputation for an excellent student experience, for excellence in teaching and learning. You yourself mentioned some of the aspects of experiential learning, and we know that you know, we've maintained great co-op programs throughout the pandemic, and I think success will look like, you know, the continued growth in our partnerships where students are getting that kind of experiential learning. Also, you know, hanging on to the things that work well in the pandemic in terms of what we've learned about use of technology and kind of more of a seamless digital experience for our students, where we have both the advantages of the face-to-face, which is crucial, as well as that sort of, you know, the students that we have now are what they call, you know, digital natives. They're students who've been online all of their lives, and I think that part of the student success in the future will be our ability to continue to meet them there. I also think about faculty success, though, and Malcolm mentioned you know, some of the aspects of being supported, equity, inclusion, because we know that the pandemic has not affected people equally, and so how can we provide the support so that people can successfully, you know, get their career trajectories going, and also feel supported in the challenges that they've been facing in their teaching as well. So those are some of the indicators I'd look for. Thanks
very much. So Sharmila, there's a question in the chat, but I have to say this is a question that has been asked of me when I do see people or when they email me, and this has to do with ventilation in building. It has to do with, there are some older buildings, can't open windows. How are we handling the issue of ventilation, which has proven to be so critical in the whole understanding of the transmission and keeping safe during of COVID?
Okay, so thanks Charlotte. Throughout the COVID-19 pandemic, physical resources has followed the public health information to assess and adapt ventilation in all of the University of Guelph buildings. Outside air has been used to maximize where possible, and the air handling systems have been adjusted to run on a PERT cycle at the end of each day. Occupancy sensors and carbon dioxide meters are monitoring and adjusting ventilation as needed. This is done automatically. Each building has a unique air handling configuration based on the space and its use. So I know there are questions on the older building that probably do not have these sensors. So physical resources are working to assess what I only think there are possibly less than 10 of those buildings. So we will be working with those individual leaders and those specific buildings. About 150 other buildings all have these air sensors that are being monitored and adjust based on its needs. Some buildings, I know for sure, the science building has a fresh air circulation, so those are not needed. So we're working through them. If there's question on any specific one building that you have concern about, you can either reach out directly to physical resources through a work order or Melissa, and we'll work through those issues for the specific building.
Thanks very much. And another one for you, Sharmila, and it's one that's come across our path many times through other means, and that has to do with how we're going to accommodate parking if people do return for less than full time. Clearly, if people are back full time, they would expect things to be similar. But if they're back on a more part-time basis on the physical campus, are you looking, I'm not asking for commitment, but are you looking at the issue of parking?
Absolutely. So right now, parking is free. So if you're coming on campus right now, it's free. We are looking to reinstate parking in the fall, and understanding that some people will be here on a cohort basis, part-time, 2 days a week, 1 day a week, etc. We're looking at flexible payment options that will be available to you to use.
Thanks very much. And I'm going to ask Gwen about graduation, a couple of interesting and I think really important questions. And I've been thinking a lot about this as we've had virtual graduations, and I know we all miss the in-person graduation, but I think for the students in particular, where I might have been to 100, this is year one. And so it's a really important occasion. So the question is, how are we handling graduation? For those students who didn't get a live graduation, could we imagine doing something live for them at a future date in order that they can get together with their cohort? What are the discussions around graduation? And I might ask Gwen, but also Daniel, I know as well that you're deeply involved in the planning of graduation.
Yeah, and I'm happy to have Daniel comment as well. But certainly the conversations I've been involved in while we're again planning, the virtual convocation for this June. The understanding is that we hope that I think by June 2022 we will be having live convocation, and that we will also offer the opportunity for special live convocation for students who were not able to have that, for them to come back to campus. But I think Daniel's office is more directly involved, so I'll let him build on that.
So yes, that's correct, Gwen. We are looking. We in all of our communications, we've been committing to students who have graduated virtually that they will have the opportunity to come back to campus and cross the stage, at a time when we're able to do so, recognizing that that's very important. I must commend the team, though, in ceremonies and events, Claire Alexander, in partnership with university partners, in her ability to actually create, I think, a very exciting virtual, convocation in a box, as they called it, celebration actually that each student can and engage that way. But we do know that the in-person ceremony means so much to people as well, and that'll be a memory for the rest of their lives. There also will be, though, as we look through making decisions for this fall, that'll likely be probably made more in August time. But as Provost Chapman said, we are looking for next year to be able to hopefully resume in presence. I should also say we also are doing a grad tour, sort of thing, where through social media we're able to engage a lot of people to be able to talk about their experience, to be able to create some memories digitally as well in the meantime before they can actually have that cross the stage experience.
Let me see if I have one or two. I know we're getting close to the end here. I do want to say there was a question that I read, and I'm trying to scan all 190 out of them, and I really appreciate your engagement in this. And this has to do with how will campus life change? And clearly, we don't have. In fact, someone this morning at a meeting I said my crystal ball is very cloudy. And I think that it's true. I think there will be more face-to-face. I'd be surprised if I think we'll probably still be wearing masks indoor, and many people are wearing masks outdoors. In fact, especially if, depending on the circumstances, we will also have learned some things about COVID. Funnily enough, I always remember past graduations where we used to shake hands with myself and then President Vaccarino, and at the end of the graduation, he and I would always say, okay, we've got to run and wash our hands. I think we will have learned some new public health, and we'll need to maintain those. I think around the culture and around the restoration of that sense of community, one of the things that's driving me, and I think many of us, is how do we restore that sense of community, that sense of place, but a safe place. So I think there will be changes, but I think it may be a little bit too early for us to answer that question. I'm going to ask Gwen one question around timing. There's been a few questions around when we might expect to know some of the academic decisions. Kind of, you're working through those with faculty, with chairs of departments. Can you give us a sense of timing, maybe not a specific date, but at least some evolution?
Sure. So I think one of the questions was around, when will students know? And at this point, the plans are that we will have course information available to students around June 21st, so around the third week in June. And course selection, we hope, will be able to start July 5th. Now, prior to that, I would say we're at the end of March, over the next 8 weeks, we will be very, looking at building that schedule and monitoring the predictions. I mean, particularly, as you said, around physical distancing. But I think that we will, have pretty clear information by June.
Thanks very much, Gwen. And now I'm switching. See, this is a problem. I'm switching to the dismissed, the new, the published. There's just so many great questions. I am going to perhaps leave this at this point and begin to wrap up. So one of the comments made, interestingly enough, is about how important this Q&A and this type of communication is. Communication has been probably one of the most important and most difficult things to get right. As Daniel said, some people felt we've over-communicated, and yet we felt that as we got new information, we needed to share it. Similarly, particularly, there have been a number of questions around vaccines, which we may not have answered, like, for example, should you register? Absolutely, if you can. Register. Of course, everyone 60 and over has been able to register with the Guelph Public Health in order to be on their list. I don't know, Sharmila or Daniel, if that age group has gone down, but certainly they're already moving towards vaccinating that group now. So fairly soon they will be moving down, and so it's really important. So we will continue to communicate so you do have that information and can take advantage of all the resources we have available for you at the university. But I do know that there are many questions we haven't asked, and there are some questions that weren't directly related to COVID, but to other issues of safety on campus. We will be reviewing all of those questions. We will be reviewing all of those questions and, as much as possible, having an FAQ. If it's not COVID related, it may actually emerge somewhere else on the website, because that kind of interaction is incredibly important. But I do appreciate the comment that this kind of Q&A reduces people's anxiety, and it's one of the reasons why, as we were planning this, I said to the executive, I think we need to do this regularly. I think even though and maybe you'll get tired of us here of doing this, but I have a feeling that there are lots and lots of questions that we all have that are unanswered. We have lots of just small questions which we don't know where to pose them. By having these forums, you're able to pose them, because no matter how small or big the question, it's an important question. Because if it is something that's worrying you or causing you to pause, then we need to respond to it so that you feel reassured, and so that, but it also gives us a lens into how you're viewing the return to campus and the campus on a go-forward basis. So these events are very important to all of us. So we will be rescheduling. We will be scheduling, excuse me, another one. I want to reiterate that we will be publishing this on our website so that you are able, or colleagues who weren't able to join us, are able to review it and see the question and answer. And I also want to end this. I don't know, I take from the questions, there are a number of students. In fact, there is one student who's emailed, who's asked a question, and it's the only student who I say is actually an international student away, and that's the question around, do they need to quarantine on campus? According to current federal regulations, Daniel, I believe that international students coming into campus do need to quarantine with campus, but if you could give us a very quick answer, that would be helpful.
So we have, yes, quarantine facilities on campus for international students who are coming in.
Okay. So I do want to say all of the students who joined us today, thank you. I want to also wish you luck. I know this time of year is last assignments, getting ready for exams. I have a son who's doing a master's online, and just the stress has been really difficult. It's been a very difficult time to do everything on Zoom, Teams, and so on. So I do want to say, look after yourself, be well, and best of luck in your exams and assignments. And similarly, I want to say thank you to our faculty and staff. As we reach the end of term, there's always an incredible flurry of emails, queries, exams, makeup tests, assignments to mark. I know this is a busy time of year, and I do appreciate that. And I do hope that as we have if we have some decent weather over this long weekend, you're able to enjoy it a little bit. And I promise you that we'll be in touch. And as you know, you can always reach out to me. I try as much as possible to respond to all emails that come in, sometimes in a more timely and time than others, but certainly trying to be as responsive as possible. And if you have further feedback, please feel free, in addition to us answering your questions on our website, please feel free to email myself or Kim McCoggan, Audrey Jamal, and of course we have our new member of staff, Krisha, who will be able and willing to support you as we go forward. So on that note, I want to say thank you all for joining us. Have a lovely long weekend. I do think the weather is supposed to be nice, and that seems to be the thing most to look forward to these days, is to be able to get out for a walk and enjoy the sunshine. So we'll be back in touch. Thank you very much for joining us. Bye-bye.